The Sapinda Rainbow Foundation challenges young South Africans to pit themselves against the world's toughest conditions. The Clipper Round the World Yacht Race is an alien concept for these young people, many of whom have never seen the sea, let alone an ocean racing yacht. The challenge builds confidence and perspective in a personal voyage of discovery. And the Sapinda Rainbow participants take these leadership and team-building skills back into their communities and personal development.
Having been selected, this will make a very huge change in my life as well as in my community, because we come from a community where there is no motivation and we are not encouraged to go follow our dreams.
And when we get back to South Africa, we have to make sure that we inspired others, our youth, we benefit them to get involved.
In the 2013-14 project, the team raised awareness and funds for the Nelson Mandela Children's Hospital. A poignant legacy. Madiba passed away during their voyage, but his values live on, an inspiration for a new generation. Now they're not only changing their own lives, but also touching others and supporting a new group of young people for 2015-16. They have also identified their next charitable project. A unique independent community health project is based here, and it has developed a research program which could unlock the rapidly growing challenge of managing the AIDS epidemic worldwide. 1 in 5 of this small township is HIV positive. The Ndlovu Care Group was established by a Dutch doctor who moved to South Africa back in the early 1990s. He quickly recognized that he could do more good here than back in the Netherlands, and his planned 3 years in the country turned into a lifetime passion.
The apartheid system left so much on inequity and inequality that it was not only health, but it's also education, it's infrastructure, it's access to water, it's unemployment, it is chances in life. All those aspects contribute to the double epidemic where we are in now, the neglect of a disease in a neglected society. And if we see the young man just passing by here, you see full-blown AIDS, and that young man should have been detected earlier, managed earlier, and been looking after earlier. And I think that we can contribute to a solution there.
An holistic approach to health and community care has made a huge impact. Their work is built on 4 pillars of healthcare, childcare, community development and research.
Well, we are still in one of those clinics where HIV is so prevalent and the patients come late. We have an average per week of 1 or 2 patients dying in the waiting area because they come so late and there's no access to care previously. And that's a reality. We still live in a country, despite of its fantastic antiretroviral and AIDS treatment rollout, into a country where we daily have 650 people dying because of AIDS. And they do it here as well. That's a difficult environment to work in. But here you see patients who come too late, being infected with HIV/AIDS or TB, and we say no. Nobody is too advanced. You're only dead when you gasped your last breath. So we fight till the end, and this unit here survives around about 60–63% of the patients do survive.
The Sapinda Rainbow Foundation is bringing its young ambassadors here to understand the challenge at first hand, as they prepare to support this remarkable project and raise awareness and funding for its groundbreaking research.
When we draw blood to measure how is your HIV doing, we barcode it and we freeze it. So when we are starting together with Sapinda on that research and development part up here, we have lots of material which is gold for Africa. In South Africa we have an average of 17% of the population who is HIV positive. In Holland it's 0.01% who is HIV positive. So we can learn a lot from them with the high technique and the expensive drug, But they can learn a lot from us if you want to do fast research. Because 1, 2, 3, 4, 5 you're positive. 1, 2, 3, 4, 5 you're positive. That's how it is in this country.
South Africa is one of the sub-Saharan countries with the highest HIV/AIDS prevalence in the world, creating a considerable reduction in life expectancy. The reality is that thousands of people in this small community are on long-term antiretroviral drug treatment, and the long-term effects remain unknown. They are typical of HIV patients across South Africa and in developing countries around the world. The aim of the new research program is to learn about the long-term effects of living with HIV infection with a multidisciplinary approach. It will focus on a long-term study of 2,000 people receiving care by Ndlovu, with half of the group being HIV positive and half negative.
Don't give up.
The research will investigate the cardiovascular risk for HIV patients on long-term antiretroviral drugs, evidence of early aging in HIV patients, and the dynamics in processes of resistance development. It has the potential to make a huge impact on people living with HIV infection and to unlock the new challenge in managing the AIDS epidemic worldwide.
Yeah, we've now taken in total 4 ambassadors down here. I mean, they can definitely recognize the issues because they're faced with these issues in their own townships or rural areas. And I don't think there's going to be any doubt that this is going to be one of the drivers that they're going to be motivated to go out there as the race will go around the world to support this funding need.
Help us to support this innovative research project. Together, we can achieve something remarkable.